A report from the UN Children's Fund has flagged a decline in childhood vaccinations in the country. Unicef says COVID-19 has been one of the contributing factors to the problem, in addition to general reluctance for vaccination in Africa. There are just over 100,000 unvaccinated children in South Africa. Dr. Lesley Bamford is with the National Department of Health, and she joins us now to take a look at this. Thank you very much, Doc, for your time this afternoon. What does our own data suggest?
So, good afternoon, and good afternoon to the viewers. So, our own data suggests we look at different indicators with regards to immunization. The main indicator that we look at is the proportion of children who are fully immunized by the age of 1. That means that they've received their primary immunizations by the age of 1. Now, we did see that this number declined quite steeply during COVID, particularly during the hard lockdown. But we did run a catch-up campaign. And by the last financial year, our figures have returned to pre-COVID levels. That said, it means that between 80 and 85% of children are fully immunized by 1 year of age. So the majority of children, but it does mean that almost 1 in 5 children have missed 1 or more vaccinations. So obviously that is of great concern to us, and we continue to urge caregivers to bring their children for vaccination, and of course from our side to make sure that we make vaccination services as accessible as possible, that vaccines are always available, because essentially we need parents to bring their children forward for vaccination, and we need to make sure that we provide those vaccinations.
COVID-19 aside, what was the situation before the pandemic? What were we seeing? So we have seen for several years that approximately 80% of children do receive all their vaccinations before the age of 1 year. The pattern that we see is that the vaccinations that are done earlier, at 6 weeks, at 10 weeks, at 14 weeks, we have high coverage. We do then see a tail off in coverage for later doses, 6 months, 9 months, and particularly for the doses that are given after 1 year. We think that means that people would like to have their children vaccinated. In the early months, people are attuned to taking their children for vaccination. But we know that as children get older, parents become busy. They have other priorities. They may be at work, and there seems to be a tendency that then parents or caregivers miss those the opportunities to have their children vaccinated. You know, the 9-month immunization, for example. So we understand that happens. We do offer catch-up doses, meaning that for most of the vaccines, the child doesn't have to have the vaccine at exactly the right time. And so it's important that parents know that, and that if children have missed immunizations, they know that they are welcome to bring their children back to our facilities to get those doses. What do you say to a caregiver that says, well, I could miss 1 or 2 or not even vaccinate my child? What's the worst that could happen?
Well, we know that vaccines are possibly, or certainly one of, if not the most effective public health intervention. Child mortality rates have declined significantly across the world, including in South Africa. And one of the main reasons for that is that children no longer die in large numbers from vaccine-preventable diseases, particularly measles as an example. Hundreds of thousands of children across the world used to die from measles.
these days measles has almost disappeared. So I think, I guess to parents, we would just encourage them to help them understand that vaccines really protect their children from a range of diseases. There are a number of diseases that we don't see in South Africa anymore, polio, diphtheria in the main, but we've seen some resurgence of those diseases in surrounding countries, or in the case of diphtheria, we've had 2 cases in South Africa. So any complacency is really misplaced. We don't see these diseases because we control them through vaccination. If we don't vaccinate our children, we leave them as individuals at risk of some of these previously common and very serious childhood diseases, and we leave our communities at risk of experiencing outbreaks.
Thank you very much, Doc, for your time. Dr. Lesley Bamford from the National Department of Health.